With only one way out of this pandemic, no building in Britain is being overlooked in the bid to vaccinate the nation. Blackburn Cathedral, the latest, experiencing its own conversion from church to vaccination centre, one of 10 opening tomorrow in England, as the government announced the rollout was heading in the right direction.
The plan is to get 90% of the most vulnerable, which is the over 80s and those with extreme clinical conditions, vaccinated by mid-February. And by September, we want to have every adult offered the first dose. If we can do it quicker than that, great, but that's the roadmap.
Given that, when do you think we can start to see lockdown restrictions eased?
We hope by early spring to be in a better place in terms of the lockdown. I think it wouldn't be done in one big bang. It would be done probably through a phased approach, probably a reversion to something akin to the tiers we've seen before.
More than 3.8 million people have now received their first dose, including more than half of people over 80. And this week, the vaccination programme will go further, with over 70s starting to get the jab.
We will be moving probably from later this week into the over 70s, clinically extremely vulnerable patients, and health and social care staff. So we really need to start to get the numbers through.
But expect to see very low numbers coming through UK airports. From tomorrow, all arrivals into Britain will have to quarantine for up to 10 days and show proof of a negative test. The government fearful new variants of coronavirus could derail the vaccination rollout, but some fear the new rules don't go far enough.
I think the list of exceptions is too broad. That still poses a risk for infections coming into the country. We also need people who are being advised to quarantine after they arrive to be followed up repeatedly. And I know nobody likes to talk about this, but this type of monitoring is very, very common in other countries.
The UK is, though, looking to other countries. Ministers here considering the idea of quarantine hotels, similar to those already used in China and New Zealand, where travellers are sent to self-isolate. Accused of moving too slowly in keeping COVID out, the government is now desperate to stay ahead in getting jabs in arms and fast.